Good afternoon, everybody. Happy to be here, and it was an interesting conversation. I remember I've heard about this project in 2018, if I'm not mistaken, and so it seems to me quite a lifetime ago, especially from my perspective. But I'm very happy to be here and to see the progress. So today the idea is to share. There is a lot of talk about this federated data. Federated models, federated data approaches. But lots of the time when I heard about that, I had the same perception that I had when I hear people talking about artificial intelligence or machine learning or even technology. Sometimes I became a little bit frustrated because I recently show a pen to a person and say, this is technology. Okay, so you have to use the right words, or at least to understand what's inside the words. So I think it's not working. Technology. Speaking about technology. Okay. No? Okay. No. Too much. Okay. Now we could. Okay. This is. So there is this concept which I learned some years ago, which is the suitcase words. So in a suitcase, you can put anything you want. And so in federated, exactly in the word federated, as data, when you talk about data, you can put anything you want. So clinical data, secondary use of data, retrospective data, data extracted from the voice transcription of a patient and a nurse's, omics, multi-omics, any kind, those are totally different. Those are data, but are totally different and requires different approaches. And even federated or centralized are words that inspires different things in many people. I've learned that inspires things to me very differently than what inspires to lawyers. That's what I've learned in the past, in the recent times. So first, starting by why AI today is so cool. So I've studied AI at the university, and believe me, it wasn't yesterday. So it was like 35 years ago, okay? So why now everyone is mad about AI? This is not my slide. This is Andrew Ng. Andrew Ng is one of the most prominent speakers, and he makes also a lot of AI for healthcare. And basically, he shows a very, very easy concept. So he say, oh, we have two things. So first thing is the amount of data. The many we have, the better we could do. But also, we have to create large neural network. That large NN that you see is large neural network, which is not something very mystical or magical, is mathematical, okay? It's very easy. So you need to have a lot of data, and you need to have a lot of computing powers to run large models, very large models. That's basically the point, because you want to have performance. And in healthcare, performance is very significant. So you don't complain if Amazon will show you the wrong recommendation for your holiday gift. So if they made a mistake, it's not a problem. You pick the other one. If Netflix will show you that the wrong series to see this evening, those are machine learning examples you see every day. So it's clear machine learning. They have many data, and they put you the right series or the right recommendation. It's not a problem. But in healthcare, performance is key. So we need to have many data and large models, lots of computing power. That's basically what we need to have. It's very simple. But the data is not the data. The quality of the data is paramount. And the quality of the data, this is basically, is called GIGO. So garbage in, garbage out is something that everyone knows in the world of data. So if you put garbage here, you will have garbage there. It's very easy. But it's not only this. So lots of the time, the quality of data is understanding the data inside. Understanding. So because even if we think about Europe, and Europe is quite coherent in a way, we don't use the same drugs across countries. So in other countries, we use drugs for a treatment. In other countries, another drug. Even some drugs are not available in some countries. So you need to have big data, which are coherent from many countries, which are pretty tricky, and also to avoid data fallacies. Data fallacies is something very common. Let me show a very easy story. We launched with the municipality of Genoa, the city where I grew up. They asked me, oh, can we launch something about AI? Genoa is pretty relevant on the AI. I say, well, let's do something like that. And the mayor asked us, can you do something about understanding the most risky area in the city. Oh yeah, we can do something like that. Have you the data? Yes, we have many data. And so the data, anyone think about the data. So we go after the data, and data are very diverse, which could be good or could not be that, good. And so we need to harmonize the data. We go on harmonization in a couple of slides, but basically with the harmonization, we have to take off many things because they don't speak to each other. And at the end, we have the GPS location, which is something relevant for them, and what is the type of the incident, death, or something like that. And so we create a heat map, the concept of a heat map. At the end, it was very funny because the most risky area in the city were the hospitals. Okay, so you need to understand the context of the data, not only the data, to avoid, survivorship bias is one of the examples of data fallacies, but there are many. So also to understand what's in the data. When you think about federation, so this is a general concept of federation, is a bit, you can have a centralized database where you have this ingestion pipeline. So I took data from many places and I harmonized the data, or I can have a federated database, which is virtual. So you have many databases, which contributes to create a central federated data space, which is, the dream of everybody is to give autonomy. So everyone is king in his own garden. This simply doesn't work because data will not be of high quality, will not be coherent. So there are different types of federation. So you can get federated access. That works. You see that every day. Have you seen when you log to your airlines company and they say, hey, would you like to log with Facebook? This is federated access, okay? There is a third party which gives you the access. So you negotiate your access, your identity with Facebook, and they accept the claim from Facebook to allow you to enter in the airline websites. This is federated access. It works. It's pretty common. It's pretty used. It's good. Then you can have a federated architecture. So we share the same standards. And so we share the data in the same way, which is good. It's something that, for example, is being Gaia X is doing that in Europe nowadays, even when we speak. Then we can have federated data spaces. So we say, okay, data is distributed locally, but we consider those distributed locally databases as a single database. There, the complexity starts to kick in because we need to have harmonized distributed data sets, which is much more tricky to do. And you want to do, this is something that I hear many times because they say, okay, federated data space is a dream for many because they say, okay, they have their own concerns about access, governance models, maintenance, security, and everything. So let them keep this at bay. But it doesn't work because they need to harmonize all the data. So it works, and then the dream is to do federated learning. So I don't want to run this large neural network, these complex algorithms on a central database. I want to run distributed, which has been done by Google, actually, but it was done successfully when you have a single application that creates the data. So it was a case of an application created by Google, which run on Android phones, and they run distributed federated learning on that, and it worked. So if you have something that creates the data, then you can be federated because they are coherent by definition, because they were generated by the same application. But the level of complexity of doing federated learning is increasing when you move there. So you need to find the right level of autonomy. You want to give the autonomy on the access, fine. You want to give the autonomy on architecture, good, because we can go on the architecture also, and you can raise the interoperability. But when you want to move further, it's more and more complicated. Let me show an example, and I was happy that in the last panel they said something like that. You may remember that Italy was the first country which was stricken by the pandemic, okay? Italy is fully federated. So data are decentralized, 20 regions, 20 databases, 20 rules. Everyone is king in their own garden. Okay, you see what happened? It happens that basically the presidency of the Council of Ministries say, hey, can you give me the data about the infection? Very easy data. How many infections do you have? And the data were wrong. So the presidency of the Council of Ministers says, okay, let's change a little bit the game. You send me the data and I will validate that. It was an ingestion pipeline. Then I will create a centralized data space and I will publish that on GitHub, which is now is still happening. 3 years after the pandemic, March 2020, if you go on GitHub, you can see the updated data of the actual infections in Italy. And that leads to a huge innovation. Let's check how many papers came from that database about the infections, about the undiscovered, about everything. And this lets Italy, which has the oldest population in Europe, to face the pandemic with a very low death toll. So they decide to get back from Federation and say, no, I want to have data quality control. I want to benchmark this. And we discovered that, for example, the main region, which was the first stricken by the pandemic, so Lombardy, which is probably one of the best from a healthcare perspective, was one of the worst in the data. So this was an example, but when you see to harmonization, I don't remember that you cite too many things that I did, for example, but we work, for example, in Pakistan. If you want to harmonize things, I remember when we get in Pakistan, I take a look at the data. And after just one afternoon, I say, hey, there is something wrong here, because 89% of the infected people are male. It's simply not true. They say, no, but because there is this testosterone, and so, no, yeah, okay, come on, but it came from Italy. And I see that there is a different, distribution. I say, oh, God, it cannot be true. And the data came from Lahore. It doesn't come from the rurals. Simply, women will not be tested. So they have to change that. Or when we go in Kenya, say, wow, the death toll is insignificant. They were simply not testing people, one end, and we discovered that, for example, only 2.5% of the population were over 60. So when you mix data in a federated model, but they live there to be king in their own garden, you never see that things. If you don't put this data, if you don't harmonize this data, you will totally miss these things. That's why you need the time to do quality control and data set processing. And that's basically what it was the center. Anyone thinks that doing AI is so cool because it's like, talking, everyone see, I don't remember the name, Stark with, Iron Man that talks, hey, Jarvis, there's something like that. And he creates these very cool algorithms. It's not like that. 90% of the time you do this, okay? And you do that. So you do ingestion, where you discover where are those data. You have to clean the data. You have to transform the data, and then you have to enrich the data. Data is raw material, very raw material. Data is worth nothing at the beginning. Then you have to treat them, to process them, to curate them. And then there is data harmonization. When you have data which came from different streams, you have to harmonize those because they have to speak to each other. Even the measurement. Across Europe, we do something for the kidney. Chronic kidney disease is very tied to a couple of measurements from lab testing, creatinine. We discovered that even in Italy, there are slight differences in the measurement of creatinine. And we need to harmonize those. We need to correct those to have a coherent measurements. And so first ingestion, and then there is harmonization. But you want to create high quality data sets because we garbage in, garbage out. With high quality data set, we will have great results. Even in that case, remember Andrea and G, it was funny because in 2017, he releases this paper and he says, okay, we have an algorithm that could detect pneumonia from chest x-rays as a level exceeding practicing radiologists. So it was good. Everyone was talking about that. Wow. They create a database with 100,000 scans for over 30,000 patients. So pretty big. In the US, they have not many concerns about gathering data. And so they could do that. But it was funny because everybody, I came from this world, so computer vision. And when they released the paper the first time, we said, oh, there's something wrong there. Because basically, when you train those algorithms, so we do all the, the boring stuff about cleaning and reaching and blah, 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 annotating the data. And so they are doing the cool things about the creating the algorithms, you separate in two. And so you have the training algorithms, and so you have the test portion of the data sets. And they divided the data sets, 100,000 scans randomly. And many people from the community say, hey, no, it won't work, because you will put, obviously, if you have 100,000 scans for 30,000 patients, you will have more scans for each patient. And so you have to divide them not randomly, but randomly by patients. So keep the data of the same patients in the same area. And so they have to send out a correction 15 days after. Today, we do the things again, it still works. So even if you have, very high quality data sets, top level professors from AI, you risk to do something wrong. But that's where we want to go. We want to have high quality data sets. So the most common words that I've heard throughout the morning was trust, which I believe totally. But for me, it's granted. I want to have high quality data because I want to save lives. Because that's basically, I like Deepak this morning, have a pin on his shirt which says data saves lives. And that's the moral imperative, basically. Here, data is not, for suggesting you the good present for a holiday or just to recommend a good series for this evening, but it's for saving lives. So basically, to recap, centralized is like being on a plane. It's much more secure to stay on a plane. You centralize the investments. And so there is this very interesting sentence from the Goldacre report. NHS asked this Professor Goldacre to make a revision about what's happening in the data. And he writes a very interesting sentence to say, he said, creating a central data platform cost a fraction of the cost of building a new hospital. Why we're not doing more than that? And then, so it's a very interesting one, but basically, it centralized the investments, governance, resources. We saw that throughout the morning. All these reflections, all this conversation is very difficult that it could happen if they are distributed and decentralized. So it's a dream, but we increment the cost. And also it will maximize data quality, data variety, and data security at the end. Basically, it will simplify the compliance. Federated is a car. So to come here, I drive with the car because I need to, and then I jump on a plane. So it's not mutual. It's good for decentralization. It's good for giving autonomy. And for example, there is a lot of talks about monetization. Because if you keep the data and you give out only a portion of your data, you can monetize those. It's great for specific part of complex architecture. If you want to, for example, federate data access is much better than centralizing the data access, much more secure. It's great for specific scenarios. For example, in the project that Elena was citing this morning about Latvia, so for gastric cancer, there is this new tool which is being created about measuring the breath analyzers. Breath analyzer will be coherent and will create a standardized way of measurement. And so it could be used in that case for wearables. It's good. But basically, it increased greatly the complexity. So it's not a solution for everybody. Thanks a lot.
Yeah, exactly.
Sure.
Thanks for a great presentation, Andrea. I just wondered, you talked about the challenges of data curation and of
would you like me to go back on the slides?
I mean, it's I've got the slide in my mind. It's 95% data wrangling, data curation, 5% deriving insights. When I don't know whether you've had a chance to look at the EHDS, the draft legislation, but yeah. One of the things that seems to be missing with that, we've got the role of data holders, etc., but the role of data curators isn't really described, and as you say, data curation, data, all of that work.
No, you're right. You're right. I think that as they say, basically EHDS probably is one of the most interesting projects that I've seen. I'm totally agree with many of the speakers before. The system is so fragmented, and so that's a big problem. So fragmented even in the country, as we saw in Italy, for example, from where I live. So it's great to have a centralized data space to allow, data portability and so on and so forth, the citizen in the center. And so the vision is great. The technical details are totally missing. No technical details at all. Not only, data curation, but also the standards. Which standards do you want to use? The data quality, how do you measure the data quality which is inside? Because we have, garbage in, garbage out. So you imagine garbage, the European health data space, it will create garbage outcomes and garbage analytics. It's true that having those centralized will centralize also the investments and the governance. And so it's better to make mistakes and then correct there, as they said, rather than, stay shy and don't do anything. But no, technical details are totally missing so far. Yeah.
I know that you have worked a lot in Gaia-X as well. And there has been a lot of work done in terms of data sharing models, governance standards, and all of that. So I wanted to understand, in your opinion, what can we learn from that? And can it feed into the European health data space as a learning and as also a baseline of governance?
Yeah, Gaia-X was created with this vision of total decentralization. So everyone is king in his own garden, and it was created on automotive, to be honest. And so they want to generate money outside of data, basically. And so that was the vision. And that's why when we met on the healthcare, and I was there just for the greater good, you know that very well. But basically, and so there's a problem, because there are many researchers that want to access the data, and they say, but I don't want to pay for that, because I'm not sure of what I will create from the data. So there is a complexity there. But I think that having a standardized architecture, even the components, Gaia-X recently released a components to exchange data or insights, so high quality data, because high insight is a high quality data, through a standard means by measuring also who is sharing what. That is a great lesson, I think, to carry out. And also Gaia-X is a great initiative per se, because it moved the reflections of the people towards the data, and it moves the reflections of the people towards the different quality of the data, different quality level of the data.
Yeah, thank you for the very interesting talk on AI. And I have a question, or maybe also a comment. I think what we also discussed in the panel before, and what you said in your talk is really important. We need to have more information about this, because I think that if patients have to decide on whether or not to use the data, they need to know a lot more of what really happens with them and what you can do with them. And like the slogan you show here with this data saves life, that really came from patients. Yeah? So I think there is a strong need. And when we talk to the patient advocates in Austria, most of them are really in favor of sharing data. Yeah? So I think it's interesting to reflect also the discussion of the panel before and what you said, because I believe that from how you explained it also, it's very logical why this is needed and what the benefits would be. And what we see in lots of our survey experiments, for example, in Austria, is that there is a lot of conspirational thinking and distrust in science, yeah, and people who are just suspicious. Yeah, and I think what we really need to do, and that's what lots of people said, is we need to invest a lot more into health literacy and also science literacy, probably among the general population. Yeah, so that people would trust science and would trust these types of analysis.
If I can add something, I think that basically the main point that you probably need is an initiative, but all the discussion, I go to many conferences speaking about AI, and especially in the past years, it was about AI will steal our jobs and will kill us all and blah, blah, blah. So it was about trust. Even in that case, what you need to show the people is the potential, what they could obtain with that. So a specific use case with a specific impact and a specific value for them. So with this, you create a trust. There is a Latin sentence, it comes in mind because I see this repeating of the trust, which was a great work. I don't want to, which is excusatio non petita, accusatio manifesta. So if you excuse yourself and say, hey, I'm taking care of your data, I'm taking care of your data, I'm taking care of your data, you create the perception in the other say, is they taking care of my data? So, but I say, yeah, I will take care of your data, but I will give you 10 years of healthier life more. I think that is a stronger message, and probably is the things that you need now that you have launched the observatory. Thanks a lot.